Kick off.
Let us pray. Almighty God, who in your wisdom and goodness have appointed the offices of leaders and county assemblies for the welfare of society and the just government of the people, we beseech you to behold with your abundant favor as your servants, whom you have been pleased to call to the performance of and trust in this republic. Let your blessing descend upon us here assembled, and grant that we treat and consider all matters that shall come under deliberations in so just and faithful a manner as to promote your honor and glory, and to advance the peace, prosperity, and welfare of our county and of those whose interest you have committed to our church. Amen. Honorable members, in line with our standing orders, number 32.2, I want to direct that the quorum bell be rung for the first 5 minutes. And I want to ask Honorable Adega, on behalf of the whip, whip in members who may be out. Honorable Adega, I can see the House has attained the right quorum to transact. Ask the sergeant to seize. Clerk, can you take us through the order of the day?
Honorable Speaker, Third Assembly, Fifth Session, Order Paper number 426 of Wednesday, 3rd June 2026 at 9 a.m. Order number 1, Administration of Oath.
Next order.
Order number 2, Communication from the Chair.
Next order.
Order number 3, Messages.
Next order.
Order number 4, Petitions.
Next order.
Order number 5, Papers.
Honorable Ratib.
Thank you, Honorable Speaker. Honorable Speaker, I stand to lay a paper. A report of the Committee of Lands, Physical Planning, Housing, and Urban Development on the report of consideration of the City of Kisumu Charter. Honorable Speaker, let me just peruse over item I'm looking for, that assembly report. Thank you, Honorable Speaker. Honorable Speaker, the net is not coming out. It's still buffing. Okay, let me use the hard copy. Thank you, Honorable Speaker. Honorable Speaker, pass on to the orders number 192 of the outstanding orders I wish to table today, Wednesday, 3rd June 2026, report of the Lands, Housing, Physical Planning and Urban Development Committee on consideration of the City of Kisumu Charter. Thank you.
Honorable members, I confirm a receipt on the report of by Committee on Lands, Physical Planning, Housing and Urban Development on the consideration of the City of Kisumu Charter. And I want to confirm that the report is properly before the House Business. And so this report will not be referred back as the House Business had already considered it. Next order.
Order number 6, notices of motion.
Honorable Ratib.
Thank you once again. Thank you once again, Honorable Speaker. Honorable Speaker, I want to give a notice of motion that of the report of Lands, Housing, Physical Planning and Urban Development, that this House adopts the report of the Lands, Housing, Physical Planning and Urban Development Committee on consideration of the City of Kisumu Charter. Thank you, Honorable Speaker.
Thank you, Honorable Boyton. Next order.
Order number 7, statements.
Next order. Honorable Adega, what is it?
Thank you, Madam Speaker, for giving me this opportunity to give a statement. Madam Speaker, there's a story which is going around that members of county assemblies receive some money from somewhere to mobilize people to join the rally which was made by ODM in Kirembe, Madam Speaker. The person who is giving this statement on a national TV is a senator of this county, Madam Speaker.
Honorable Adega, that does not amount to a personal statement. And the person you are insinuating made such statements is not here to defend himself. So I want to direct that you do a proper statement, bring it properly if you want members to discuss the same statement, because the said member or the said person also has the right to defend his case. So I want to rule you out of order, Honorable Adega.
Thank you, Madam Speaker. I'll make a special statement to this House, Madam Speaker.
Thank you, Honorable Adega. Next order.
Commencement of business, order number 8. Motion, approval of the motion on the matter of equipping community health promoters.
Honorable Moses Ochele.
Thank you. Thank you, Honorable Speaker. Honorable Speaker, I would like to move a motion on the matter of equipping community health promoters. That, aware that the community health promoters, that is CHP, play a critical role, frontline role in the delivery of primary health care services across the sub-counties, wards, and villages of the Kisumu County, serving as the first point of contact between communities and the formal health system, particularly in hard to reach and undeserved areas. Noting that the community health promoters operate under community health strategy as envisaged in Kenya's health policy framework, the Kenya Community Health Policy 2020-2030, and Constitution of Kenya 2010, which mandate the devolved units to ensure the progressive realization of right to the highest attainable standard of health for every resident. Acknowledging that the effective execution of the duties of the community health promoters is largely dependent on the availability of appropriate tools and equipments, including but not limited to blood pressure monitors, glucometers, and test strips, weighing scales for adults and infants, thermometers, mid-upper arm circumference, tapes, delivery kits, community health information kits, personal protection equipment, and functional communication device to enable timely reporting and referrals. Acknowledging that the vast majority of community health promoters in Kisumu County currently operate without adequate equipment, thereby severely undermining their capacity to screen, monitor, refer, and follow up on the patients suffering from non-communicable diseases, maternal and child health conditions, and other preventable illnesses, leading to avoidable mobility and mortality in the county. Cognizant that the county government of Kisumu has previously, in the previous financial year, allocated budgetary resources under Department of Health towards community health services, yet the actual disbursement and procurement of equipment for community health promoters has remained inadequate, uncoordinated, and some instances completely absent, leaving the community health promoters to rely on their own source or go without. Deeply concerned that the continued failure to equip the community health promoters adequately not only undermines the spirit and intent of Community Health Promoters Act of 2023 and the universal health coverage agenda, but also erodes community trust in the health system, discourages volunteerism and commitment among the CSPs, and expose communities to preventable health crises that could otherwise be addressed at the household and community level. Recognizing that equipping community health promoters is a cost-effective and high-impact intervention that would significantly reduce the burden of health facilities, improve health outcomes, strengthen disease surveillance, and contribute towards the achievement of the Sustainable Development Goal 3 on good health and well-being, as well as Kenya's Big Four agenda on universal health coverage. Now, therefore, in order to fulfill the requirements of the Constitution and relevant laws, I pray that this assembly do resolve A, that the Department of Health and Sanitation in Kisumu County be directed to urgently conduct a comprehensive needs assessment of all registered community health promoters within the county to establish the specific equipment gaps and develop priority procurement list within 30 days upon adoption of this report. B, that the county executive committee member for health and sanitation be directed to ensure that adequate budgetary provisions are made in the current and subsequent financial years, estimates to cater for the procurement and distribution of essential health equipment for all community health promoters in Kisumu County. C, that the county government of Kisumu, through the relevant department, fast track the procurement and equitable distribution of identified essential equipments to all community health promoters across the 8 sub-counties within 60 days of the completion of the needs assessment. D, that a monitoring and accountability framework be established to ensure that all procured equipment reaches the intended community health promoters and that the records of distribution are maintained and made available to the county assembly upon request. Madam Speaker, generally, by and large, this motion is targeting the key point in handling primary health issues. Madam Speaker, most areas within our county are very remote, almost inaccessible. And Madam Speaker, this particular group, community health promoters, they sacrifice a lot, Madam Speaker. Even at night, some of them receive calls when emergencies occur, like urgent labor pains, malaria attack at nights. And Madam Speaker, walking in the dark without torches, walking in the rain without raincoats, Madam Speaker, is just not just jeopardizing their survival, but also limits them in providing this very essential service that they are expected to offer to the community. And Madam Speaker, if we are true to the calling that health is key and good health promotes development, then Madam Speaker, I request this House to stand up and support this very important sector, health sector, so that we minimize communicable diseases and also reduce spread of diseases that can be protected. Otherwise, Madam Speaker, allow me to request member for Kubura Ward, Honorable Bill Oliver Diambo, to second the motion. Thank you.
Thank you, Madam Speaker. Madam Speaker, I rise to second this motion. These are very important motions to the people of Kisumu County, because down in our wards, we have very remote areas where accessing health centers is something that is not easy. Madam Speaker, the community health promoters, they're the first contact with these people. And being that this is a health department, they should be equipped really to at least show some image and give confidence to our people. One, Madam Speaker, we should even have and get to a point whereby the community health promoters for easy access should be even given motorcycles at some point. Right now, the last financial year, there was a budget to equip the community health promoters. And I really want to support this to be fast-tracked so that they get the equipments necessary to help control even some diseases that don't require people to go to hospitals. So, Madam Speaker, I want to second this report, and I believe members will see it fit for Kisumu County. Thank you.
Honorable members, a motion by Honorable Ochele on the matter of equipping community health workers has been moved and properly seconded by Honorable Billy. I therefore want to propose that the motion be open for discussion. Yes, Honorable Adega.
Thank you, Madam Speaker, for giving me this opportunity to echo the motion before the House. First, I thank my colleague, Honorable Moses, for bringing this motion before the House, Madam Speaker. It was my dream also to bring such a motion before this House, Madam Speaker. In the last 2 weeks, I met almost 100 community health workers and assistants in my ward. And they listed the problem they are facing, Madam Speaker. Madam Speaker, the stipend they are receiving, it is after every 3 months. And in this year, they received the stipend for the arrears of last year in February. And in this year, they have not received any money at all, Madam Speaker. Madam Speaker, some of them are being covered with SHA, NHIF, which now it is SHA, and some of them are not covered. And remember, they are the primary doctors on the ground, Madam Speaker. Madam Speaker, their protective gears is very important, Madam Speaker. As my colleagues have said, during the rainy season, they receive calls where they walk at night without even a spotlight, rain boots, even the helmets for their protection, even their security. It is not in good line, Madam Speaker. Madam Speaker, the gadgets they are using, sometimes they are faulty and they need to be repaired, Madam Speaker. And by that time, if they have not received their stipend in earlier enough, whether it is peanut like that, Madam Speaker, they should be given money monthly, their stipend monthly, for them to get even data, because they need data to give the data Wi-Fi to give the data report to their supervisors. Thank you, Madam Speaker. I support this motion. I strongly support it, Madam Speaker. Thank you.
I saw 3 honorable members rising at the same time. Allow me accord this privilege to the lady of the hour, Honorable Mildred.
Thank you, Madam Speaker, for recognizing that I was among the 2 gentlemen. I want to support the motion on the matter of equipping community health promoters. I want to support Honorable Moses Ochele, member of East Kano Wawidi, for bringing up this motion. Madam Speaker, we all know that the community health workers are in the front line and they're the first people that get in contact with the sick people in our communities. And Madam Speaker, just as has been mentioned, that they are going through a lot of challenges in their duty. One of the challenges that can hinder the program is on the stipends. I want to agree with Mheshimiwa Honorable Adega that it is true we have talked to the community workers and they are complaining that their money does not come on a monthly basis. It does not come on quarterly basis. Now we are in the month of June. Still, the money that was allocated has not reached them for this year. Madam Speaker, it's very discouraging when you look at the community workers and the weather conditions that sometimes they work in. Sometimes the rains are very heavy. Some areas are flooded. Some don't have gumboots. They do not have raincoats. They don't have umbrellas. These are very minor issues, Madam Speaker. And it's very embarrassing that at this time, we are discussing equipping the community health workers, while we are the same people that passed the budget in this assembly, Madam Speaker. Madam Speaker, it's important to allocate budgetary. In the budget, we allocate money for equipping the community health workers in the Department of Health, so that in their duty, they're able to work under favorable conditions, Madam Speaker. Madam Speaker, it's interesting that some of those areas they work in are the flooded areas, like in Kano, where Honorable Ochele comes from. Sometimes Honorable Ochele cannot even make it to the assembly. I sympathize with him. Last time when the rains were heavy, Ochele's car was flooded. In fact, his home was submerged in water. So you can imagine the community health worker working in such a condition. I was trying to explain the condition which the community worker go through, and I gave an example of Honorable Ochele and many other members in this assembly, that their members are going through the challenge. The matter of stipend needs to be looked at. I also talked to some of them that are complaining about the insurance, that many of them are not covered under the SHA, and it becomes very hard when their families fall sick or some of them fall sick and admitted in hospital. This motion has come at the right time when we are about to allocate the budget. And I believe this assembly will allocate the budget to the health department so that the community health workers can be equipped. I support the motion on the floor. Thank you.
Yes, Honorable Nyauke.
Thank you, Madam Speaker. Madam Speaker, I want to sincerely appreciate the honorable member from East Kanoa Widi for coming up with this very important motion to this House. Madam Speaker, Constitution 2010, Article 185, Section 3, places the whole issue into the doorstep of this Assembly. And that still is under oversight. Madam Speaker, the motion mover has really put it very clearly. And given that we do have these PHCs in our wards, actually in our homes and villages, we see the type of situation they are in, Madam Speaker. Madam Speaker, it is also important to note that these very people, they are more than volunteers. If you look at the sacrifices that they do back at our places, Madam Speaker, sometimes you sympathize with them. And I tell you for sure that they also love the work they are doing. They struggle even to do what they are supposed to do. Madam Speaker, it is through this House that we now have to make sure that they get all the apparatus that they need to make their work easier and to make their work successful. Madam Speaker, these people are the same that make sure that despite the fact that some of them don't even have electricity supplies in their houses or their homes, they make sure that their gadgets remain charged. Their telephone, their phones remains charged. There is no time that you can call a PHC and you find them that they are mteja. Afadhali, some of us you might find as being mteja, but those, seriously, there is no specific time that you will find that they are mteja, meaning they are out to perform their tasks as much as possible. Madam Speaker, by provision of these mandatory and yet important gadgets that they are supposed to use, is not only encouraging them, but they will also realize that the work that they are doing there back at home is also being felt to be important by all and sundry. Madam Speaker, I would really thank this House if we can all come out and support that all these necessary items, the gadgets, and my colleague also did mention about the stipend that they are being given, Madam Speaker. I think as we go through this, as we make sure that this happens, then can we also go ahead and make sure that the little stipend that they get, Madam Speaker, it is important that they get them in good time. However little it is, they have gotten used to it, but at least if it is found in good time and reasonable time, then it will also be of good help to them. Madam Speaker, with that few remarks, I beg to support.
Honorable James Omola.
Thank you, Madam Speaker. Madam Speaker, I support this motion and I want to thank Honorable Member Moses Ochele for bringing this up to this house. As lawmakers, we are the budget creators, and I think it is upon us to allocate funds for this. Madam Speaker, just a few months ago, I was with the PS Health, Dr. Luga, in my ward at Apondo Kasai Secondary School. And he was meeting all the health promoters in the sub-county of Nyakach. And I listened to them. Madam Speaker, if you are in that meeting, we were with the only Honorable Anne. I listened to those mothers and fathers. They are really not taken good care of. That is the truth. And as an assembly, we have to assert our authority to oversee what goes on in the Ministry of Health. We have a very nice system in the Ministry of Health here, in Department of Health, and very capable CECM and Chief Officer. So it is upon us to make it a mandatory for budgetary allocation so that these CHPs can get whatever they deserve. On matter stipend, they told us that they are coming, they have two parts, one coming from the county government of Kisumu and the other one coming from the Ministry of Health. That one coming from Nairobi comes very oftenly. This one that we do as a county government is not predictable. And I want to agree with Honorable Adega. The stipends they get should be monthly or bi-monthly as soon as possible so that they can proceed. On matters gear, Madam Speaker, during rainy seasons, these mothers and fathers really undergo hell. We need to equip them very well in terms of lighting. They should have torches, in terms of raincoats, in terms of umbrella, whatever it is, so that they are comfortable in their work. The drafters of our constitution of Kenya were not wrong to put them as level 1. This is our level 1 hospital, the CHPs. Before we go to the dispensary, which is level 2, and the health center in level 3, we have the level 1. So the same thing, we take care of these health facilities, we should take care of our level 1s by budgetary allocations. And I wish the chair was here, but we have the members of the health committee, Honorable Lumumba and Honorable Moses, and you, Madam Speaker. We should really equip them by doing so in the budgetary allocation. So as we ponder on the estimates this coming financial year, this should be a priority because it is very practical. Every mother or child in this country are being taken care of by these CHPs. And the earlier we take care of them, the better. It will increase some of the services to the Wananchi. And I think devolution meant that the service should be put to the doorstep of Wananchi. Thank you, Madam Speaker. I support.
I saw Honorable Boyton, but now the majority leader is on his feet. I want to allow Honorable Lumumba to proceed, followed by Honorable Boyton and Honorable Ouko in that order.
Thank you, Madam Speaker. Madam Speaker, allow me to apologize to Honorable Latif because he's seated behind me. I did not notice him, otherwise I would have returned to my seat. Madam Speaker, I'm personally elated with a report, and this is a clear manifestation that our members are human enough to consider our CHPs. Madam Speaker, again, I thank the members because now they have echoed the advice of our Speaker here, not officially when Kamkunji, twice or thrice. He has always appealed to members to see how best they can accommodate our CHPs. It has come to the realization of the members, going by the contribution and the motion mover, that this is now becoming a reality. Madam Speaker, these Good Samaritan are very important and they have helped so many people. Initially, they were volunteers. That tells you how passionate they are in this call of their duty. But again, now, there is something that they are being given. They are not complaining, but they are being given this thing piecemeal. Sometimes it is delayed. it is our duty to see how best we can support their services by making sure that their stipend is given the right time. And go further even to lobby the national government, Madam Speaker, to consider engaging these our good people upon the expiry of the contract. If anything, actually, it is the national government that has been sustaining these good people, not the county government. The county government money is not even anything that one can budget or even go and borrow money knowing it will come on such and such a day. As members of this house, we should now ensure that there is timely disbursement for the money that is given to our CHPs as a matter of motivating them. Madam Speaker, I can give my personal testimony, the very sad one. About 2 months ago, one of the CHPs saved the life of one old baby that was thrown in the bush. At night, it was raining. She went, took that baby to the hospital. As a community, we made sure we supported the kid by providing nuns and what have you. Now the kid is about 2 months old. It is the same CHP that is staying with that kid because the parents are not known. Look at that kind of role that these people are playing at no cost. Recently, I attended a funeral at Kanyipir, and I was impressed that in Kanyipir, there is a slot for CHPs to speak at a funeral to enlighten or even propagate what is there for the community by the same CHPs, as opposed to those who want to be aspirants, talking a lot of, I don't know whether they are nonsense or not, it makes sense. But to me, that is more important than other people. So I really commend the Kanyipir community for recognizing the role of the CHPs. Madam Speaker, equipping the CHPs is something that we cannot ignore. And even if we are waiting for the budget allocation, there's something I've always said in this house, that we came here to represent our ward. The meaning of devolution, it does not mean that once the devolution goes to the county, it cannot be devolved again up to the ward level. That is what it should be. And even going by the budget, we should push for each and every budget allocation to go to the ward. Then we will not have this problem of coming here to cry what should be done. But we will be giving our location or even equipping them depending on the need. Each and every ward has different needs. Maybe in town here, the CHPs are not as many as they are in the rural areas. So their budget is different. So if it is put in the what is called the county kitty, maybe they will just consider a few, not knowing the rural areas demand more. So it is us to ensure that this allocation is devolved up to the ward level. It is not lost, even as we are talking now, that when we go for budget and we get our money for ward development, which we need to increase, we should take care of that immediately. More so, equipping the CHPs. They actually face a lot of risk. Some of these CHPs, they deliver even women at home without gloves. Because when the worst come to the worst, someone is delivering, you don't have gloves, and it is at night, what do? They go as far as risking with their bare hand to deliver. And that will leave unto God. And God has been very, very faithful to them. And this should not that if God is faithful to them, God will continue. God is also looking upon us that what are we doing to support this, his help. So I appeal to our members that when we get our ward development, please let us also do something for the equipment, for equipping these exposed and vulnerable volunteers, the community. Madam Speaker, I therefore support the adoption of the report. Thank you.
Honorable Boyton.
Thank you, Madam Speaker. Madam Speaker, I don't want to look at this motion from the perspective which most members are viewing this motion. This is a good motion, Madam Speaker. But there are questions that we need to ask as members of this county assembly. One, the mover of the motion and the seconder of the motion said very clearly that in some remote areas, we don't have level 1, level 2 hospitals. The question is, what is the county government of Kisumu doing to provide the dispensaries and the health centers in these areas? That is key. Honorable Speaker, in this era where health had been devolved, people still travel, people still move very long distances to seek medical attention. That is a lapse in the government or the county government of Kisumu. Number two, Madam Speaker, equipping of the CHVs is not a problem. But the problem we rely on this suppliers of this equipment. The budget will be raised. A gumboot or a gumboot that goes for around 1,000 shillings. The supplier will ask for 3,000 or something of that nature. And that money for value will not be attained. So in my opinion, Honorable Speaker, I see that the best way of strengthening the community health workers is to increase their stipend. They can buy gumboots, they can buy raincoats, they can buy umbrellas for themselves. Let us give them money. Honorable Speaker, why would somebody sit at Prosperity House, Department of Health, and earn 100 and something thousand, yet a CHB who is down in the rural area is given 2,000 shillings a month? Where is our priority as a people? Number three, Madam Speaker, 2 weeks ago, various committees were meeting the departments. The motion that is on the floor, was it factored in the budget estimate? If all we are talking about is not in the budget, then we are not serious to ourselves. The chair of the Committee of Medical Services should have told us clearly here that the budget is in this financial year, so that we know for sure that the CHBs will be taken care of. And if that note, that budget will be rolled in as soon as possible. So, Madam Speaker, the motion is a good one, but the level of how it is going to be done raises question in terms of funding the proposal. So, Madam Speaker, I rest my case by saying that the community health promoters, the stipend should be increased to a level of 5 or even 10,000 per month and be paid promptly. Thank you, Madam Speaker.
Proceed, Honorable Oka.
Thank you, Madam Speaker. Madam Speaker, let me congratulate the Chair for Mr. Honorable Chele for a wake-up call. In fact, this is a wake-up call. These community health promoters are our voters. They are our people, they are our sisters, our brothers, our fathers, and everybody. We live with them. We really understand the risks they pass through, and we don't appreciate. Really, the way we handle this health personnel is quite unfortunate. In third world countries, level 1 hospital or level 1 hospital we have so far are the community health promoters. But we have been equipping with level 2, level 3, and level 4, and leaving the basics, the most important, the foundation of healthcare. These are people who have the earliest and most direct contact with the diseases and all those. Madam Speaker, these are the people who are called even at the wee of the night to assist. They are also given the powers to administer Panadol. They can test diseases like malaria. They are also allowed to administer anti-malarial drugs. Very important people within our society. If we can't protect these people, it means we are also not protecting ourselves. Because take, for example, Madam Speaker, there is an outbreak of cholera in a village. The first person who is expected to report this and to be in contact with such kind of incidences are the community health promoters. And remember, they are not equipped with the right PPP. And there is a guideline with the World Health Organization on the right PPE based on the nature and risk involved. So, Madam Speaker, at times we come to the House and complain and lament through debating. We have the powers to reorganize the budget. We don't need to wait for the relevant department to do that. I support that we have to appropriate money meant for the PPEs and the support of the community health promoters. I support it is overdue. We have to do it. There's no option for that. Thank you, Madam Speaker.
Honorable Mildred Millicent Omoya. Thank you, Madam Speaker. First, allow me to appreciate Honorable Chele for bringing this wonderful motion to the floor. For sure, these health promoters are doing a great job in the community. Like in my village, we have one called Nyasembo. It be test of malaria, she has the kit. It be dressing of wounds, she does it perfectly. It be monitoring pressure and sugar, she does it as a doctor. I'm in agreement that these people are supposed to be supported. And I will request members that let us put more efforts on the executive so that their arrears are also paid. And on top of that, I will also want us to establish, are they all in SHA? Chances are high that some of them might not be registered under SHA. So I'm just proposing that it is important we hear from the Chief Officer of Health or the Minister he should be brought or called or invited to come and shed light on this issue of health promoters. I support the motion. Thank you. I saw Honorable Oraro on his feet. Yes, Honorable Kelvin.
Madam Speaker, I want also to join my colleagues in supporting this motion. Although if you look at the conclusion of the motion, you realize that there are some prayers that the mover of the motion wanted, that upon adoption of this very motion, within the 30 days, the CEC member for health should at least do some of the things that are supposed to be done. The other part of it is about the budgetary allocation. Madam Speaker, I want to borrow from what Honorable Boyton was talking about and saying that it is not just about a motion and saying how good it is, but this motion was brought to us not to appreciate but to see a sense and even to act if possible, especially during this time that we are doing a budget. I know that the budget committee, the health committee is there. The budget committee will be trying to make a proportionate budget that will cater for most of the expenditure in the next financial year. I think this motion was trying to aim towards that, so that action is seen to be done. We are not just doing a debate like the one in high school, giving out ideas, but we are giving a debate, contributing and giving out authority to CEC Health, to the budget committee, to health committee, that some of these factors that we are talking about should be considered, and by next financial year, we should be seeing action. We should be seeing procurement of these kits that is needed to make things work. And for that reason, I support the motion, and I'm asking the Assembly, after the adoption, to consider that during this budget talk or give and take, something should be done. And that is up to be done should actually be actualized, so that when you are approving the budget, some, if not all, will be considered in that budget. Thank you, Madam Speaker.
Yes, Honorable Gadolim.
Thank you, Madam Speaker. Madam Speaker, having read the motion and looked at the prayers of the mover, Madam Speaker, allow me to concur with Mheshimiwa Boyton Ratib that we don't allow, because it's a common practice that we do procurement, and lately do they get to where we want them to be. If this motion could be approved by this House, that we allow the CHVs to be given the funds to buy this equipment by themselves. Madam Speaker, look at the procurement in this county to date and the new system of EGP. For you to procure all these things, because some of them were out nearly after 2-3 months, it's not very possible for the department to be doing those regular procurements. So I would propose that as we fight for this group of our good ladies and men, we allow them to be given that top of the stipend, on top of their stipend, we give them the money for the materials that they need. Because looking at Kisumu Central, I don't think the number of gumboots that is needed in Kisumu Central is the same that is needed in East Kanawawidhi. And therefore, it's an individual requirement that each and every CGV wants a specific thing. Some want raincoats, some just want to gumboots, some want gloves, some want different materials. And therefore, I think the best way, and looking at how our today dispensaries are working, level 2s and level 3s, and the SHA that is there, I want to confirm that today, in my 3 dispensaries and the sub-county hospitals, that is level 3, we have received the money, remittance from SHA, and it's a good money. For us to have received like 1.4 million in Oboch dispensary shows that that thing is working. And therefore, if you attach these resources back to those dispensaries, because all these CHVs are attached to specific institutions, let's not allow these things to do bureaucracy of bringing back these things back to this system of the Department of Health. Let's devolve these things to the institutions down there, so that they become part of this thing. Those who go to those dispensaries and those level 2s and all that are brought by these CHVs to those institutions. They're the people who are pushing these people to get out of the houses, get to the hospitals, and that's how we earn this money from SHA. Can we allow these things to be devolved back there, so that the sisters in charge and the management in charge can help these people procure what they need at specific levels? But if we domicile this thing at the county headquarters, it will not work for us. Can we get away through this motion that we devolve these things to specific? If it's an individual dispensary and they have 2 units or 3 units of CHVs, let them know their demand, let it be implemented at that point of the institution, not talking about the CC, the chief office and all that. It will take us a lot of time, it will take a lot of bureaucracy, and we will not get what we want. Otherwise, I want to support. That's a good motion, but we want to look at it differently, so that we get to the bottom of all that thing. What Moiton said about procurement is a very key thing. Let them procure at their local source, at the village level, so that each and every CHV gets to get the best of what they need at that village, not for the whole county. Thank you.
Yes, Honorable Okoye.
Thank you, Madam Speaker. Madam Speaker, let me also join the queue and I appreciate the move of the motion. Madam Speaker, my contribution will squarely go on the side of the monetary. And this is what the stipend which are paid to the CHVs. Madam Speaker, I was shocked. I've also been meeting these Kenyans who are working very hard for our communities to have the primary health. Madam Speaker, the payment or the stipends which are given to these Kenyans is pathetic. And to add an insult to this money is taken to the bank, and when they are going to get their money or withdraw from the bank, you find that bank still deducts that stipend. So we may say they are getting 2,000 or 3,000, but when they withdraw, they get less, and they complained. So in this motion, Madam Speaker, I would also urge or ask, if the stipend is taken to the bank, let us see if the bank would want their interest, then let the CHBs get their full amount without deduction. So that is the point I wanted to put across, Madam Speaker.
What are you proposing, Honorable Okoye?
I'm proposing that the department should have an MOU with either the bank, so that the interest they would accrued on this, the allowance which are being given to the CHPs are deducted from the side of the county government of Kisumu, not the CHVs. And it's very, very sad, Madam Speaker.
I want to use standing order number 1 to give you a leeway to make an amendment. You want to do that? But you have to have a second.
Madam Speaker, I would ask if we can amend, but I would need to have some time to see how to amend it. But that is the idea I would want us to put in that motion as a recommendation.
Yes, Honorable Wajewa.
Thank you, Madam Speaker. I would like to appreciate the move of the motion. I also want to support and concur with my colleagues on the this matter of the community health workers. Madam Speaker, as you are aware, community health workers, they are the first line personnel when it comes to health issues in our communities. They work as caregivers. Some of them are also work like counselors, and some of them also work like psychotherapists. They are the people who get in touch with the community. When somebody is sick, even at night, they will be called upon to give first aid or to give, to examine when it comes to these other diseases like malaria, because they have the kids. So I would concur with my colleagues so that their stipends should be increased. These other things they can buy on their own once they have the money, because their needs are different. You will get them, some of them have a gumboot, but they don't have raincoats during the rainy season. And you'll get that some in town don't even need those gumboots, but they need something else which can assist them in carrying out their duties. So I would wish to recommend that their stipend should be increased, because it is a mockery to the healthcare professionals in our villages, because what they are being paid is peanuts compared to other health care professionals in the hospitals, like nurses and some other people who help in the community. Madam Speaker, they should also be trained. They should also be given a basic trainings like the caregivers are given, so that they know how to use the equipments they have, health equipments like the ones for high blood pressure, machines for the high blood pressure, for malaria, kits, and those other issues, and even give medicine to, because I'm aware they also give medicine to these other kind of diseases which are not, before they are referred to the health centers or to the health facilities in the region. So my recommendation is that they should be, their stipend should be increased. Thank you so much, Madam Speaker.
Madam Speaker, this matter of community health workers is not coming up for the first time in this House. Madam Speaker, I remember the first time this matter came up was 2021. It was deliberated. At that time, the problem was on stipend, which was in arrears, was never paid in time, and the committee made a ruling. The House made a ruling, and the payment was done, and I think there was a relief to these our people. This motion that has come up today, when I was keen, it was talking on the equipment to be used by the community health workers, which is not adequately provided to them. The matter of stipend has also come up. If I may start with this matter of stipend, it was 3,000 that was allocated. 500 was to be paid for their medical cover. That by then it was National Hospital Insurance Fund. Then 2,500 was being paid in quarterly. That was 7,500 after every 3 months. I think that was the practice by then. I'm getting the picture that this stipend is in arrears, as was echoed by Honorable Adega, that in February, that is when they were paid part of the last financial year. Madam Speaker, that is a very bad practice. And if that is what it is, this assembly must address that. We don't just talk. Must go find out and make a ruling to the department and find why they are not being paid as they should be. That is when we shall have discussed this matter. Another matter, Madam Speaker, is the equipment to be used by these our people. They are the primary healthcare worker in the community. So we must give them the due regard that they deserve. It has been discussed here that the procurement system is elaborate. The procurement system is expensive. What should be bought by 1,000, you may buy at 3,000 or above. Suggestions are being made. But Madam Speaker, when I listen to this motion, the allocation for the equipment has not been stated. Whether the allocation has been there for the last 2 financial years, including this one, has not been stated. And we know now that our health facilities collect their own money, their own fees. As has been elaborated by Honorable Gadolema, that their Obach Health Facility recently received 1.4 million. Very good amount that will help the health facility to manage itself. So we need to find out if the equipment for the community health worker should be bought from the headquarters or should be done at the health facility. Once that is established, then we make a ruling and we see where the problem is. Because if these people are supposed to have the gloves, they are supposed to have the gumboots and other equipment, and they are not being given, they will feel frustrated. They will not do their work adequately. And we need to get the facts right. And I wish that was done, that their allocation for the equipment of the community health workers was this. The procurement was not done, and they are suffering on the ground. Then we find, if this was their allocation, why did the department fail to procure the equipment? What was the problem? Then we will be discussing facts. We will be moving in a direction to give orders. But Madam Speaker, before we reach that level, I will ask, and I wish the chair of Health Committee would be here, or the other members, to give us direction in that order, so that we make a decision that we can defend. And Madam Speaker, this is when I digress a little and give examples, like when the matter of the streetlights came here, and we were condemning the department. We ended up not making a good decision because their location was not given. There was no clear indication from the department that they also feel frustrated because of this and that. And so they cannot serve the Kisumu people of Kisumu adequately. And do you know what I came to find out, Madam Speaker? When we are interrogating the sectorial budget, allocation for the streetlights is in the finance department. And the energy is in roads department. So if we are not keen to establish all this, we shall be making our irrelevant decision. And when we shall now ask the implementation committee to do a follow-up, they will be doing nothing. So let us get the clear picture. where the allocation for this equipment is, and why they are not being provided. And Madam Speaker, the Assembly will make a wonderful decision. I so submit.
Yes, Honorable Member representing North Kisumu Ward.
Thank you, Madam Speaker. May I also join the queue of supporting the motion on the floor, Madam Speaker. Madam Speaker, indeed, the issue of our CHVs is tackling in the ground. Our major issue concerning the CHVs, Madam Speaker, our people back at home, they are our relatives, they are our parents, and they do suffer being that they are not being taken care of. The issue of their stipend coming out to 3,000 is much far below what they can sustain their life with. And concerning the provision which they should be given, Madam Speaker, instead of giving them the additional kits, my opinion was the additional amount to be placed on the stipend so that at any particular time, each and every community health worker can purchase any gear at any moment he feels like. Because the procurement issue within this county brings a lot of commotion. It takes a long time before they purchase the gears within themselves. And as for our community health workers, Madam Speaker, we usually meet them on a daily basis. At the doorstep, we meet them each and every now and then. Within our regions, Madam Speaker, the health facilities we are having is about 5 kilometers away. And those who handle our people within the locality are our community health workers. So that, Madam Speaker, they should be taken care of by providing them with the necessities that makes them work better at a particular ground. And purchasing for them the gears will not be of that importance. Madam Speaker, with the few remarks, I also join the queue to support the report. Thank you.
Honorable members, if no any other member wants to contribute, or if members feel that the motion has been sufficiently deliberated upon, then I want to call Honorable Ochele to reply.
Thank you once again, Honorable Speaker. Allow me to respond to some few remarks or concerns raised by my colleagues. Madam Speaker, before I make any comment, allow me to take this opportunity to thank all the honorable members who have contributed directly or those who had passion to contribute but have not done so. Madam Speaker, apparently, this motion kind of touches the hearts of this House. And the very way it touches the hearts of these members is the very way it touches the hearts of the entire community based on the operations by the CHPs. Madam Speaker, initially, this category of health providers were called community workers. That was abolished because our worker is entitled to salary. It was then changed to community health volunteers. And that also changed to the current title, promoters. Madam Speaker, this cadre of citizens promote health at the very bottom of the pyramid. And Madam Speaker, if they are indeed promoting health, us as a house, we should also ensure that we promote them in whichever way we can do it. Madam Speaker, a number of members have proposed various ways of ensuring that these people work at a conducive environment with proper gadgets and commensurate earnings. Madam Speaker, one thing which touches my heart is that these people provide health to our community. Madam Speaker, when themselves they fall sick or one of their family members fall sick, they can't be treated using the government SHA because they are not registered in SHA. So as an assembly, Madam Speaker, I will wish to request the executive, more so the Department of Health, to make it mandatory that all health promoters are registered in SHA so that they also enjoy, as they consider helping others, they themselves are put in a situation where they can also help themselves when they fall sick. And they can easily fall sick because they are exposed. Most of them are exposed. I heard what Deputy Leader, Majority Leader said here, that a number of times they've been sacrificing, helping or midwifing, using bare hands. What kind of arrest, Madam Speaker? So these people must be protected by ensuring that they get proper health service to themselves. Madam Speaker, these same people, Madam Speaker, as they were used to call volunteers, to date, they still volunteer in a number of ways. Getting a stipend of 3 million, not adequate, cannot sustain their lives, but they work 24 hours in a week, 24/7. Considering 3,000, this person working from morning to evening to the following morning, it is not something worth mentioning, but it is just kind of to buy airtime for their communication. Madam Speaker, recently I had a conversation with one member of parliament, a member of health committee, and they told us that this financial year is the last when the national government will be sending their stipend to this cadre of people. Now, Madam Speaker, if the national government withdraws and we leave them to the hands of the county government at a rate of 3,000, which is very intermittent, Madam Speaker, then I think we'll be trying to kill the very primary health source. And therefore, as a house, I feel we should be emphatic that the county government increases the stipend upwards and then makes it as a salary. When they are considering paying salary, when they are running the payroll, Madam Speaker, they also must ensure, alongside the payroll, that these community health promoters are paid. It becomes regular and in an increased manner. Madam Speaker, there are proposals on how to buy the equipments. In the current budget for 2025-2026, there is allocation in the Department of Health for equipping these community health providers. And Madam Speaker, the Committee of Health should contact the Department of Health why this has not happened, despite having a budgetary allocation. Why is it not happening? And Madam Speaker, if that's the case, then it calls for what Honorable Ouko and Honorable Gad were proposing, because it is like the department does not see the need for equipping this team. Then it might call for even individual members to apportion a budget in their ward-based allocation so that they monitor procurement as they monitor procurement for development projects, they monitor distribution, and they monitor the outcome. I think, Madam Speaker, that can kill the fear of accountability. But talking of giving them additional money specifically to buy these gadgets, Madam Speaker, that is completely impracticable. Going by the poverty level in our society, give me money, you want me to go buy gumboots, you want me to buy a torch, and my children are going hungry. My child has been sent back home for school fees. Obviously, I'll give priority to what affects me directly, like that which affects my family. None of them can go that mile of purchasing. They'll just say, thank you, you've given us additional fee, and I have additional baggage in my house. I'll spend the money as I wish. So we must put checks and balances to ensure that they have the actual gadget. If they are enlisted as enlisted in the motion, Madam Speaker, then we budget based on that and ensure that the same is provided to the very individuals. There are different categories or different population. Like a member said that the number of CHPs in my ward, East Kanawawidi, might not be exactly the same number as Manyatabi ward. So I prioritize my budget based on the population that I want to address, but the items remain standard. The number to be serviced might be different, but the items targeted must remain for members. We must be getting into frequent contact with these people. Day by day, we must be getting their concerns. Because if they get discouraged, the moment they get discouraged, then we will be in a big problem. The WHO standard of health facilities, the distance between one health facility to the other should be a minimum of 5 kilometers radius. We attained that in Kisumu County, more so in the rural areas. In my ward, we've not. The nearest we have achieved is 7 to 8 kilometers radius. That means the intermediaries between these gaps is the CHPs. We must protect them. We must ensure they are safe. We must ensure that they are comfortable. And we must ensure that they deliver to the best of their ability by providing them with the best environment. Otherwise, Madam Speaker, I second. I reply. Thank you.
Thank you, Honorable Ochele. Honorable members, a motion on the matter of equipping community health promoters by Honorable Moses Ochele of East Kanawawidi